Welcome, everyone, and thank you for joining us today for our National Roundtable, Gender-Based Violence and the Spread of Racism Against Non-Status, Refugee, and Immigrant Women in the Context of COVID-19. This presentation is being hosted on the traditional territory of the Wendat, Anishinaabe, and Haudenosaunee, and most recently, the Mississaugas of the New Credit First Nations. Takaranto, also known as Toronto, is now home to many Indigenous peoples, including the First Nations, Inuit, and Métis people. We want to start by saying welcome and thank you for joining us today. We are heartened by the number of people who have registered across Canada. My name is Margarita Pinton-Perez. I'm the Senior Coordinator of the Initiative to End Gender-Based Violence at OCASI, Ontario Council of Agencies Serving Immigrants. We introduced the virtual roundtable series to host conversations and exchanges that consider the differential impacts of COVID-19 for non-status refugee and immigrant women across Canada. These webinar series work from a social justice approach that thinks more about and suggests that a comprehensive analysis and collective discussion of social problems will really yield more effective social actions, advocacy, strategies, and responses. This roundtable series brings together non-status, refugee, and immigrant women, community members, frontline workers, academics, researchers, advocates, and organizational leaders from across the country to share their insights, assessments, and experiences around the unique tensions and challenges that COVID-19 introduces when addressing gender-based violence against non-status, refugee, and immigrant women. This roundtable series is organized by a national project focused on building the capacity of peer leadership and community advocacy networks across Canada. It is a 5-year project funded by Women and Gender Equality, and it's led by OCASI in partnership with the Barbara Schleifer Commemorative Clinic, the Islamic Family and Social Services Association in Edmonton, Immigrant Women's Services of Ottawa, the Migrant Mothers Project, Mosaic in Vancouver, the New Brunswick Multicultural Association in Fredericton, Rights of Non-Status Women Network, and the Sexual Assault Center of Edmonton. On April 30th, we launched the first of this roundtable series centered on leveraging the conversations, knowledges, and practices that focus on gender-based violence against non-status, refugee, and immigrant women across Canada in the context of COVID-19. As we shared at the last roundtable, this is not about leading the conversation, but leveraging and hosting the space for these conversations at a national level. The implications of COVID-19 are readily apparent across the globe. In Canada, COVID-19 is revealing an architecture of inequality, and those who were already unprotected before the pandemic are impacted differently and more intensely during this time. And this extends serious implications for addressing gender-based violence against non-status refugee and immigrant women across Canada. We know that reports are indicating that the COVID-19 situation and responses further create gender inequalities and increase risks of gender-based violence. At our last roundtable, we asked, what does this mean for addressing gender-based violence against non-status, refugee, and immigrant women across Canada? And how can we better respond to gender-based violence against non-status, refugee, and immigrant women in the context of COVID-19? What you're seeing on your screen right now is a beautiful visual summary that captures our conversation. We learned that within these new social conditions and emerging social problems are also long-standing and ongoing crises among certain social groups in Canada. Speakers provided a critical assessment and commentary to understand the changing context and spoke to gaps in capacity and services. They also emphasized the need to include and center women's organizations and non-status refugee and immigrant women survivors of gender-based violence in COVID-19 responses and efforts. We also heard from service providers across different regions in Canada who shared how they distribute their attention or their services, especially when we're being asked to isolate. We learned ways in which frontline workers working with NSRI women attend to the immediacy, but at the same time, continue to think of the important advocacy and preventative work for their communities. Inequality has been magnified, but perhaps nowhere it is clearer than when we think about non-status refugee and immigrant women. And this conversation at this roundtable really made us connect those dots and think about the conditions of risk and precarious situations that non-status refugee and immigrant were living before COVID. We want to also highlight that what was promising about this conversation was to really hear from this amazing group of panelists the reality that since gender-based violence against non-status refugee and immigrant women was already a crisis, this work is already well underway. It's ongoing, it's constant, and we were reminded at this roundtable that we do have previous work and efforts to refer to. We have the knowledges of non-status refugee and immigrant women. We have to continue to leverage that work and leverage that knowledge and center also women's organizations when we are thinking about responses and ensure that certain groups are being consulted when thinking about what comes next. We absolutely welcome you to share this visual artifact from our roundtable. We think it's a very useful tool to help keep up the dialogue and with one another, with our partners, and with our communities. You can access that visual summary on our website, OCASI's Initiative to End Gender-Based Violence. All right, so I also want to take a brief moment to acknowledge that we're in a virtual reality right now, that that can mean that there might be some technical issues that might arise. So we may need your forbearance. If you have any technical issues, please, we ask that you email directly Soel at the email provided here, or you can place your question in the question pane, and someone from our team will be able to redirect those tech concerns to the appropriate person. All right. So in today's conversation, we are focused on the intersection of gender-based violence and racism against non-status refugee and immigrant women in the context of COVID-19. We're asking that and thinking about as the COVID-19 pandemic continues to evolve, racial inequities are magnified, and we are witnessing the increasing spread of racism and xenophobia across the globe. How does this virus-related racism intersect with gender-based violence against non-status refugee and immigrant women across Canada? And as we're learning about the devastating impacts of racializing the virus on communities across Canada, what is the role of racism in this crisis? And how does this affect responses to gender-based violence against non-status refugee and immigrant women? It's crucial that we understand why and how this crisis could and is disproportionately harming racialized groups. And this is a conversation today to help us connect those dots, to help us understand the effects of entrenched structural racism. As we know, that means we have not been able to equitably respond to the unexpected crisis that is COVID-19. All right, so let's get started. I welcome now all of our speakers to enter the virtual space. If you could please turn your cameras on, your audio as well. Welcome. Great. Great to have everyone here. So wonderful. Before we start, I would love to introduce everyone who's a part of this panel, and then I will hand it off to our moderator. So starting with our moderator, Rupaline Bhuyan. Rupaline Bhuyan was born in the United States into an immigrant family of Assamese origin and immigrated to Canada in 2008. She is currently an associate professor in social work at the University of Toronto, where she teaches community practice, social action, and qualitative research methods. In 1991, Dr. Rupalin Bhuyan joined the Violence Against Women movement as a peer rape prevention educator and has since worked as a domestic violence advocate, public educator, and researcher to end gender-based violence. Her current research examines how immigration policy contributes to gendered inequality and different forms of gender-based violence, with a focus on collective action with and by migrants who seek dignity and human rights. Welcome, Rupalin. Our speakers today, I'll start with Evelyn Amponza, is a PhD candidate. Feel free to wave if you'd like, is a PhD candidate in social and political thought at York University. Her work thinks about anti-Blackness in the context of the post-racial. She has over 10 years of experience in the social service sector and is currently with the City of Toronto in the Confronting Anti-Black Racism Unit as the Training and Development Consultant. Welcome and thank you for joining us. Avi Go is the Clinic Director of Chinese and Southeast Asian Legal Clinic, which serves low-income immigrants and refugees clients. Avi has extensive experience with systemic advocacy to promote the rights of marginalized communities. She has made deputations before various standing committees at the Canadian Senate and the Parliament, as well as a number of UN treaty bodies. As counsel, she has argued before all levels of courts, including the Supreme Court of Canada. Avi has been involved in many community organizations, such as serving as the Vice Chair of the Court Challenges Program of Canada and President of the Chinese-Canadian National Council Toronto chapter. In 2007, she co-founded the Color of Poverty campaign to help address growing racial inequalities in Canada. Avi has received a number of awards, including the Order of Ontario in 2014 and the Federation of Asian Canadian Lawyers Lawyer of Distinction Award in 2012. Welcome, Avi, and thank you for joining us. Eileen Lam is the Executive Director of Butterfly, Asian and Migrant Sex Workers Support Networks. Welcome, Eileen. She has been involved in the sex workers, labor, migrant, gender, and racial justice movement for over 20 years. She is currently a PhD candidate at McMaster University. Welcome and thank you for joining us. And last but not least, Dr. Natisha Masakwa is originally from Sierra Leone and is a highly respected expert in designing programs and services which aim to increase access to primary health care for Black and racialized women. During her lengthy career, she has facilitated the development of several health organizations and programs for Black communities in Canada, including Africans in Partnership Against AIDS and the African Resource Center. She recently retired after 21 years as the Executive Director of Women's Health and Women's Hands, which is the only community health center in Canada which specifically provides primary health care for racialized women. Her research and numerous publications have focused on the use of health equity data to improve health outcomes for Black women, as well as the impact of racism on the health and well-being of Black communities. She has served as an adjunct lecturer in the faculties of social work for Ryerson, Dalhousie University, and York University. Welcome. Welcome, everyone. Thank you for participating. I'm going to hand it off now to Rupalin, who is going to get us started with the roundtable.
Great, thank you, Margarita. And it really is an honor to be here with such an amazing wealth of knowledge and long-term commitments that each of the panelists share. And I know it's a very busy time because in addition to the ongoing activism and support work that you all do, this has been a time of personal as well as community crisis. So I just really am grateful that we can come together, and I think I'm going to use my microphone and use this as a moment of pause. One of the things I'm reflecting on is when there is such urgency to act and to do to support people in emergent needs, it's also an important time to reflect on the kind of world we live in and the world we want to move towards. And I'm looking forward to hearing from you all what that could look like. And this is also a unique time, this pandemic and the associated humanitarian, economic crises that are affiliated with this public health crisis seems to keep changing. So I think as a starting point, we wanted to hear from each of you what you see as a current assessment of the situation from your vantage point, in terms of the pandemic, but also the spread of racism and xenophobia that has also surfaced. And just to get us started, I'll turn it over to Avi. I'd love to hear your thoughts. I think you need to turn your camera on, Avi.
She has your camera. I'm going to see if I can help with audio. One moment.
Also the audio. We're going to try this out.
Yeah. Okay, now I'm unmuted.
Very good.
Thank you very much for having me, and hi to everyone, and hi to people who are participating. You know, there's so much to talk about, but because I just came off from a press conference, so I thought, okay, maybe I'm going to start with that press conference and focus on that particular issue. So our clinic has received some funding from the Canadian Heritage to work with several organizations, including CCNC, the Chinese Canadian National Council Toronto chapter, Chinese Canadian National Council for Social Justice, and Civic Engagement Network in Vancouver to address specifically the rise of anti-Asian racism, you know, connecting to the COVID-19 pandemic. And in fact, since January of this year, we have been, you know, sort of working on this issue when this was not even called a pandemic yet by WHO or in Canada, because even back in January, we're already seeing a rise of incidents involving anti-Asian, anti-Chinese racism. Starting with a petition that was signed by over 10,000 parents for living in York Region, calling on York Region School Board to ban Chinese students from attending the school. And it just got worse since then, right? So, and you know, we've heard a lot of reports of violent assaults taking place over the last several months in different cities like Toronto, Vancouver, Thunder Bay, Halifax, Montreal. You know, some people, you know, a lot of it is verbal assault, but there's also been physical attacks, including a case of a Korean Canadian being stabbed in Montreal, a case involving a woman in Vancouver on the public transit. She spoke out when she saw a white guy attacking two Asian Canadian women, and because she spoke out, the guy turned against her and attacked her, and it was so vicious that he actually pulled out the chunk of her hair as a result of the attack. So incidents like that all over. And then, so we also did a poll with CCNC SJ back in, I guess in April, towards the end of March, where we asked a number of questions of Canadians in 3 cities, Toronto, Vancouver, and Montreal. So one of the questions was whether or not people feel safe sitting beside an Asian Canadian or Chinese Canadian. 21% said no. And another 24% said they don't know if it's safe. So it's like 1 in 2 Canadians said it's either not safe or they don't know if it's safe just because they're sitting beside Asian or Chinese Canadian. And what is even more shocking is that 14% of the respondents either agree with or refuse to dismiss as false the statement that all Chinese and all Asian Canadian carry the COVID-19 virus. So over 1 in 10 believe that just because you're Chinese, you are carrying the virus. So, I mean, of course, we also have seen like people like Derek Sloan, the Conservative MP, running to be to be the Conservative Party leader, going after Dr. Theresa Tam, questioning her loyalty to Canada. And also, you know, Brian Adams making his stupid tweet about, you know, his concert got canceled because of fucking bat eating wet market animals selling virus making greedy bastards. So I actually did a number of media interviews in response to Brian Adams' tweet, and then I got all kinds of racist emails from Canadians who actually support his view. So of course we know that Canada has a very long history of racial discrimination towards Chinese, Canadians, and of course other people of color. And one of the things about the type of racism against Chinese is this notion that we are foreigners. That probably is more, I guess, more so in the case of Chinese than in some other community. Like, this notion that even though we were brought to Canada to build a railroad, we were being denied the right to vote because we were strangers in the strange land, we were sojourners. So that notion that Chinese were not Canadians, is very much ingrained, thanks to, the very first Prime Minister of Canada making that comment and making that as a basis for denying Chinese the right to vote. And I think that concept never went away. And also, of course, we know that racism exists in Canada even before COVID-19. So instead of triggering racism, this pandemic really just give an excuse for those who have this racist, phobic views about Chinese Canadians and other Asian Canadians to actually act out on that belief, right? And I think, to me, really more important question is the lack of political leadership and concrete government action to combat this issue. And that is really adding fuel to the fire, in my opinion.
Thank you, Avi. And I think it's so helpful to hear, especially the work that was done at the very onset before we had the kind of shelter-in-place orders and the racism that unleashed against students, for example, parents of other children now not wanting their Chinese or Chinese-looking students to go to school, all the way to the more aggressive forms of violence that have been taking place, and of course the long history of certain groups, in this case Asians, seeing as outside of what is Canada as foreigners. And so perhaps at this point we'll turn it to Evelyn, and from the work that you're doing, what are some of the emerging issues that you're seeing in relationship to the pandemic, as well as the kind of unleashing of ongoing or new forms of racism? And again, if we can get Evelyn's mic turned on.
Thank you. Thank you for having me. I think some of my thoughts are going to resonate with what Avi just shared. For me, I've been thinking about, how important it is to know how in times of fear, there are increased acts of racism and xenophobia that are grounded in like a so-called need for safety or protection, or for people to feel that a sense of safety, to feel that they're protected, but how that's deployed through acts of anti-racism. And even just as a way for people to kind of feel better in a time where they're feeling anxious. And so in trying to feel better and trying to claim your humanity over other people's humanity, there's a way in which anti-racism really comes to the forefront. Around how we're thinking about resources, right? So initially when there were like shortages, toilet paper, for example, and how you can justify, right? How we can justify how, I need all of this toilet paper by othering other people and by undermining other people's humanity through notions of racism, through who we're putting blame on for COVID-19. And so therefore, if this group is to blame, then I can claim more things. I have a right to all of these things because it's not my fault that we're in this particular kind of situation. And rather than those analyses falling along the lines of, for example, maybe like government or institutional kind of critiques, they fall along these lines of anti-racism. I would also like to point out in the ways that, like, the ideas that live within our subconscious around racism, around other people, they, normally we're able to control those things, right? Like in a particular kind of way, we're able to control the way that we think and the way that we feel, or manage them so that they don't come so directly and aggressively to the forefront. But then in a time of fear, that kind of the way in which we manage these things, they go out the window. And then you have very aggressive acts of anti-racism. Who's allowed in these situations to manage who? So we've had specific examples of, for example, just like being in the grocery store and not, somebody perceives that you're not social distancing, or you're not giving 6 feet of space, and all of a sudden they feel that they can police you in that way, and how that's usually the examples that we have heard are happening on the lines of race, right? Where you have white men and women telling Black people, like, this is a rule, you need to follow it in this kind of way, you're not supposed to be in this space. And then who becomes the keeper, or the person that's able to manage other populations, other people along the lines of racism. And I think that also speaks to the ways in which we're most people are feeling powerless, and that feeling of powerlessness, being told to stay at home, not being able to go to your favorite restaurant or whatever else it is impacting non-Black people more so than it's impacting other folks that have always kind of had problems navigating spaces, and have always felt a sense of powerlessness in public sphere. And so now you have like more white people being like, this is not fair. But then the way in which they're exercising how that's not fair is along the lines of racism and along the lines of Black and other racialized bodies. Yeah, and I think the other thing I really wanted to mention and speak to, particularly around, undocumented or immigrants or newcomers, is the spaces that we're seeing where there's a determination of who requires protection, who requires safety, who requires testing, et cetera. And so the outbreaks that have happened in long-term facilities, the outbreaks that have happened in jails or in detention centers, the fact that these spaces are overpopulated by racialized people, both as inmates, both as people who are being detained, but also as those people who are on the front lines who are serving these populations as well. And so how that plays out in our societies along lines of race, who deserves protection, and people in these spaces are based off of the outbreaks and based off of the lack of support. It's obvious that society is saying that these people don't deserve any kind of protection from COVID-19, and the way that, for me, it's all of these things are reinforced by racism that existed pre-COVID, and the kind of resources that were already scarce pre-COVID and now are even more scarce. And so, yeah, I think that the way that racism like structures all of these things in terms of what is our response now? What do we do? What are we doing for frontline workers? What are we doing for people who have to take public transportation, who can't work from home, who have to continue to go into work? We know that the numbers tell us that most of these people are racialized people, but what is our response? Like, do we care? And how do we care about these folks other than, just some these thank yous that are going around thanking like frontline workers and stuff? Yeah, of course we should thank them, but there's something else that needs to be done to show how much we care, how much we're responding to the fact that they're more at risk. And the response is impacted by racism, right? So there's a general response that is not taking into account these intersections that already exist and that already make people more at risk of being, income insecure, food insecure, or whatever else. And so I'll stop there.
Yeah, thank you. And I think, there's so many layers of what you said that I just, thinking about how the fears associated with the pandemic, fear of people getting sick and the contagion, and obviously the struggles people are having in illness and loss of life, how those trigger, the kind of pre-existing notions of which kinds of bodies are to be feared and the kinds of behaviors that are seen as a suspect. We know that the racial profiling is not a casual occurrence, and it can lead to serious violence. And then also, as you were saying, the kind of structural racism that's just embedded throughout our system. I don't know if the word opportunity sounds right, but it really is highlighting these existing inequalities in terms of the kinds of care work that's already done, that's very low wage, often by racialized bodies. And so perhaps there, turning it to Natisha, if you wanted to share as well from the work that you've done, what are you seeing as some of the emergent issues right now?
Yeah, I'm probably going to sound a bit repetitive in terms of what Abby has already said and Evelyn, but from my vantage point, the thing that I can say for sure is that the outcome of every pandemic that we've had in this country has seen the overrepresentation of racialized bodies bear the brunt of those pandemics. If we look at the HIV pandemic, which we are still in as racialized people, you can see what the outcomes look like for us in terms of Black community, for example, and Black women in particular, and non-status women, very much so overrepresented in poor outcomes in the HIV pandemic. So we shouldn't be surprised that we're in this same situation, because pandemics only amplify the problems that already exist in society and only amplify marginalization to a greater extent. I look at this in terms of the scarcity of commons. I come out of sociology, so those terms sometimes flash in your head and you're like, oh, that's what they were talking about. This belief that there aren't enough resources to support the whole society, and therefore we need to make decisions around who deserves to survive, who deserves to be helped. And in this case, what we're seeing with COVID-19 and the response is people's reaction to who they believe is the most deserving in terms of being able to access resources that will enable one to survive. What that looks like in terms of racism and xenophobia, I think I would prefer to look at what white privilege and white supremacy are starting to look like and how they're being exerted in this particular time. I mean, we just have to look at that Trinity Bellwoods Park situation in terms of who felt safe enough to break the law and privileged enough to go ahead and engage in the manner in which most of those people did in that park. One of the responses in pandemics, and we've seen it, I use HIV because that's the one I've worked most closely in, is the criminalization. So a response, and the early response to COVID was to institute criminalization structures in place. But we see when they get enacted and when they don't, and who they get enacted on and when they don't. And when we're looking at racialized populations, particularly undocumented, once criminalization entered into the conversation, it further isolated those populations who were already socially isolated to begin with. And then the fear of going out, the fear of being picked up, the fear of being deported gets amplified. Also, I think looking at, from a gendered racial lens in terms of personal protective equipment, for example, and I'm working provincially on how do we equitably distribute the equipment across the province. And I'm looking at it from my lens, which is one of disparity or disproportionality. Who's at highest risk? And that's not what our healthcare system does in terms of looking at how do we distribute things that are going to keep people alive. And, I'm seeing this play out over and over and repetitively, and I don't think we need to repeat history here. We already know what the outcome is going to be post-COVID for racialized communities. We're just going to see an elevation of racism, white supremacy, xenophobia. It's not going to be reduced after COVID. It has been now elevated to a higher level.
I believe we may have lost Pauline's audio. We'll just work on that in one moment. All right. One moment. Let's see if we can work on that. All right, thank you, Natisha. We're going to carry on. Rupali, I think, might just need to restart her computer. So next, if we want to go with Aline, please, just if you want to speak to the next question. Thanks, Aline.
Okay, yeah, thank you so much. So I think I totally agree with all what have been said by the other speakers. So I think very clear COVID is reflect the crack of the social system, including racism and xenophobic, is already what we face every day. But I think COVID really show it more explicitly. So for example, racialized people and migrant, they always, particularly undocumented, they always been facing the economic exclusion, poverty. So, but what we see actually when the government give out the economic relief, most of them are being excluded. So Butterfly is working with migrant sex workers. Most of them also have precarious immigration status. 40% of our members cannot get served. I think this is not unique. It's also happened on with like other migrants community, and most of them, of course, is also racialized. So they are being left behind because they don't have SIM card. And so in addition, so that they are not only cannot get economic support, but the oppression is even higher, right? So now there is a lot of policing, because I think we do a lot of work related to policing racism, and policing anti-migrant is not separate. Society and government give the illusion the police, law enforcement make us safe. So there is a lot of emergency order. They claim to make people more safe. So, right, just like what you have been saying, like who are the people actually they can not being charged, or they are brave enough not being charged, is not racialized people, because they already always being surveillance, always being carding. So racial profile, they have been facing it every day. And increase of the police power, law enforcement power, actually is punishing the people, those who are poor, they don't have place to stay. When we say social isolated, stay at home, many people actually don't have home to stay, right? So, and I think this is very, very like crazy when the people are not able to have safe place to stay. They are being punished. They're giving the tickets at $1,000. So we just have a member, and so racialized people has been targeted in so many forms. So for example, we see so many, like for example, Black community is being framed as criminal. So, but for example, Asian is being framed as illegal migrant, right? Or now it's because of the trafficking campaign, they are being framed as victim. So by framing that, they are increase the law enforcement always go in like harming this community. We just have a member, because she stay in a very, very small apartment, she feel a little bit sick and she's not able to get any health support. So she isolate herself by staying at her workplace at daytime. But the law enforcement came in, give her one ticket the first day. She have been telling the law enforcement, I'm not working, there is no client, not operating. She just isolate herself by staying at the workplace. And then on the other day, she received 5 tickets from the law enforcement. We don't see, when we walk on so many shops of the white folks, they are still handling their business inside. That's not happen. So you see racism and also anti-migrant, and increase the police power by using this pandemic is really make people feel very worried. And the other thing is the ID requirement, because Ontario, they passed the emergency order that never before the law enforcement don't have power to check ID, but because of the pandemic, they use it as a reason to give the illusion police make us more safe, but actually police make all the community members, especially racialized migrants, more dangerous. But then they use this opportunity to further increase the power. What happened? We hear from the community, they are so afraid to go out because they already struggle with so many issues, but they are also need to have extra pressure. So whether when they are undocumented, when people ask for their ID, that will create extra problem. And And so that's why I think that is something we really concerned about. It's just like all other speakers say, the racism, how to like impose like racialized people as dangerous, and with COVID they continues increase that illusion and racism about that. And the other is the actual power they gain to exercise on the racialized body, so that they can arrest them, detain them, surveillance them, and kick away them from Canada. So I think this is something we really concerned about and hope people will look at. So, and the other parts, not only the government funding directly and also policing. Recently, the government also have the emergency fund. And then how they give the fund also, again, same as the income support, they go through the big funding organization. And then at the end, who will get the funding? Mainly is the white dominant organization. They have a lot of resources, write beautiful proposal. And with the funding, there is also a lot of limitation. They are not allowed to give direct income to the people. I need to name, for example, United Way. So, and so that we see who is benefit, like that people get more work and more income. Who are they, right? That who is continuous being suffer. So I think that is something we, I'm so glad have chance to connect with all of you and then share with this issue. And I think this is not unique experience, is if the experience every day by the community member. Thank you.
Thank you, Aline, and sorry I had a little technical glitch, so it disappeared and came back. I guess you all have already touched upon this, but one of the pieces of the Building Leadership Capacity project, especially looking at non-status refugee immigrant women and gender-based violence, is making more visible how intersectional these different kinds of, the word vulnerability itself is something I want to be cautious about, because it makes it seem like the people themselves are inherently vulnerable. And I think what I've heard from you all say is that these are structural problems, that disadvantage is embedded within systems and also within histories of behavior and ideas about who belongs, what kinds of bodies are dangerous, what resources are available and for whom, and then also the kind of practices that we know already disadvantage. And I keep worrying about the kinds of harms that will continue to remain less visible, whether it be the people doing the work in the public health sphere who are putting their lives at risk, who are less visible. We see this with the long-term care facilities, and also the kind of daily transactions in life that are at the spectrum of different levels of violence. And I guess wanted to invite each of you to share, maybe it's an anecdote, maybe it's a case that really highlights these intersectional pieces. What forms of this racialized violence are also gendered, also layered with issues of maybe immigration status in the places that you're working in. Partly because we're, this project is also trying to reach people across Canada. And I think each of you have this incredible analysis, but it's hard to figure out how do we make this apparent to everyone and also find ways to move forward to address them. So that's a big challenge, but I'm gonna maybe lobby it back, Aline, to you. If you wanted to, share from your own work some examples that help us see these intersections.
Yeah, thank you so much. And I think when people now is a lot of care and concern about how the gender-based violence are being happen in pandemic. So, but for migrant sex worker, it is the issue they face every day. So, and so I think many of you may work with the undocumented and people with precarious immigration status, non-status women. You know that the precarious immigration status, particularly created by the immigration law. Sometimes people don't think, oh, people are precarious. They are not born precarious, right? It's the law actually make people precarious. So, and then it's really make the people have lost their bargaining power in the relationship. And so we see so many things happen. So is when the people is difficult to get the immigration status, so that they may need to stay in abusive relationship, and the partner may also use it to take the advantage of that, right? So, and particularly for sex worker, because so even people with work permit, the immigration law is not allow people work in sex industry, so that is also can be used by their partner to use against them. And sometimes it's even not the the immediately partner, but also like other people that they can use it and abuse them. So, and I think this is something we always need to think, and there is a lot of advocate, they really care about the safety of the woman, but how to look at the systematic course, how the immigration law make people be curious, and in addition support the woman that how you need to give the real support by advocate the rights, then the people don't need to face that. So, and the other big part for the sex worker community, what is facing every day is they are not able to protect themselves. So, some speaker already talking about the criminalization, because sex work is criminalized. We have so many workers when they are being robbed, raped, even murdered. When they call the police is not investigating the murder. They are arrest the woman and call CBSA and kick them out from Canada. So that is make the worker why they cannot call the police. It's not the fear of the law enforcement. This is the reality that they really have the risk when they call as the victim. But what will happen to them? They will be treated as criminal or illegal migrant. They will be kicked away. And sometimes even they have document, the police will also investigate the people around them, because if you work with other people, they assume that other person is exploitative, so and although other people will be affected. So that is also make the worker cannot protect themselves. And in addition to criminalization of sex work, so in recent years there are so many women groups, they concerned about massage parlor trafficking, and they have the big advocate to make the law enforcement actually be more repressive to the massage parlor. And there is a lot of bylaw is make the worker unsafe. So for example, few months ago, so there was a worker murder in a spa in Toronto. So what happened is the spa, no matter holistic license or body rock parlor in Toronto, they are not allowed to lock the door. It's the basic demand we have been writing so many times. So many workers, they tell the law enforcement and the policymaker, I need to protect myself just by locking the door. I can screen the client. They say no. So, and then the abuses happen again, right? So that is the, and that is some simple thing they can protect themselves, because you're the sex worker or you're working massage parlor, you are not able to exercise this simple thing. And the other big part is people concerned about violence against women. They always say the police will come to save you. But in the experience of sex worker, who are the biggest source of violence is law enforcement, including by law, CBSA, or the police. So in Butterfly, 60% of the member has been experienced any kind of abuse from law enforcement. It's the huge thing. And so that's why decriminalization of sex work, stop the policing and targeting on this massage or related industry is very, very important, because all this give the power of the law enforcement come to the place to harass the woman. So that's why we worry about COVID, is because many people really believe that law enforcement will be helpful, make people safe, but it's not true, particularly for marginalized communities. So that is something we really need to push back. So in city of Toronto, you can't be this 25% of the by law enforcement time and manpower is go to investigate 400 massage parlor. So how the government wastes the money by this way? So, and the last thing I really want to mention is here has a lot of organization, they concern about trafficking, they concern about sex worker rights, they concern about the violence against women. But we found that a lot of NGO, they claim that, or the feminists, they claim that they concern about trafficking. They are the great source of violence, because they are advocate more law enforcement against the sex worker. They are advocate, so for example, now so many cities, they are advocate to shut down the massage parlor. What happened is make the worker lost the place to work, make them become more vulnerable. So they advocate to have more investigation. At the end, Butterfly have done so much report, all the anti-trafficking investigation. At the end, what happened is the sex worker being surveillance, arrested, detained, and deported. So this is the consequence caused by a lot of advocates. They think that they are protecting the woman, but actually they are imposing the violence against them. And the other last thing I want to mention is the exiting program of that. So there is a lot of exiting program that they say help the sex worker exiting, but that is not helping. the way they do is take away the option and force the people to do other work. So that is the huge denial of agency. So that if we care about violence against women, so, and I think this is very, very important for the violence against women world, really need to reflect on that, really need to reflect on the approach, whether you are using your own moral or whatever ideology, force the people leave sex industry. This is the abuse. This is the violence of the agency of woman body. So thank you.
Yeah, Aline, I think you laid out so well how much we have to learn from the ongoing policing and the criminalization of sex work, and how I can almost imagine like we can overlay the lessons and the continued struggles to how the governments are and the public is responding to this newer pandemic. So like everything you said in terms of the reliance on the criminal justice system to so-called save or protect women in terms of gender-based violence. I know that this is a concern that is growing, although I think historically it's been really hard for many violence against women organizations who aligned very closely with police response early on in the movement, although there's different reasons for why that happened. But also the kind of protections, the so-called protections, the responses that are put in place, like a bylaw preventing massage parlor owners to lock their doors, how it dedicates so much resources to police and then leads to more violence. I think you expelled that out so well. And to me, that connected to what Natisha was saying earlier about learning from the pandemic of HIV/AIDS. And so Natisha, perhaps you could pick up here, maybe from that work or other work, some examples of these intersectional dynamics that you're seeing.
When I thought about the question, I was thinking about just very recent phone calls I've been receiving in terms of requests for advocacy support. And they almost fall into two categories. One are mass layoffs of racialized women in organizations, especially at the beginning of COVID, and not given any real reason, just, you know what, go and get the COVID money. But then when they looked around, only the racialized women were the ones that were laid off in the organizations. I have one organization called 25 Women, all racialized, long-term employees laid off in a unionized environment, which also tells you, I mean, that these women are not vulnerable, that they're in a system that creates vulnerability. And all I was thinking is 25 women are at increased risk in terms of violence, gender-based violence, because we know lack of financial resources puts women at risk for all kinds of situations. The other category of calls that I get are women that are in PSW types of employment who are being forced to go and work in unsafe conditions, not having enough protective equipment, not having any options to choose whether to go to work or not, particularly those that are undocumented, because they A, need the resources, and B, the threat of deportation is always being held over their heads in terms of, well, if you don't show up, then I'm going to pull your sponsorship, or if you don't show up, I'm going to report you to immigration. And so you're seeing this situation where racialized women are overexposed in terms of criminalization, in terms of if all of us are at home, who's out on the street or who's available to be interrogated. And then we also have their overexposure to COVID. So their risk in terms of contracting COVID is amplified at such a great length, and we're seeing that. The other thing that I fight for is the collection of race-based data. Even this morning, I was making a sarcastic joke on Twitter, but they released the postal codes, they've released the neighborhoods, they've released all kinds of other things except the race-based data, so that we understand exactly who is overrepresented in COVID cases and COVID deaths. That ability for our system to erase our experience as racialized women is violence in itself. And so I use that concept of violence to look at it from different angles, but all of it leads to vulnerability and increased risk of violence and increased risk of detrimental health outcomes for racialized communities. And all of those things, I think, are very much intertwined in the whole concept of violence and intersectionality with race and gender.
Thank you, Natisha. Yeah, and I mean, I think the layers there too, how an event like the loss of jobs and the disproportionate loss of jobs for racialized women can trigger a series of events that really leads to, as you were saying, economic challenges, and those are also associated with different forms of gender-based violence. And the last piece you were saying in terms of race-based data collection, and Avi, I know you started off the call having just come from a press conference from the Chinese Canadian National Council, and you all have been trying to collect data on these discriminatory acts. I'm curious to see what kind of intersections are you seeing? You gave some examples earlier from the kind of data that you're collecting right now.
Yeah, so and I think it's really interesting, although it's still early stage. To start up, I just want to say a number of cities have started to collect this kind of reporting to create this kind of reporting tools. So there's one in Vancouver, one in Montreal, and the CCNC Toronto one. They started collecting the information back in February, but they just officially launched the website today. So before it was a very simple website, but now it's in, sort of like it's a lot more elaborate, right? So from the preliminary result that we get, both in Vancouver and Toronto, we're seeing that, so for instance, in Vancouver, over 70% of the people who report being targeted by racist, sort of incidents during the pandemic are women. And the Toronto data show 66% are women. So, and, of course, like there's no surprise, like even from, talking to your own friends, like I'm sure right, I mean, part of it is because who are the one who's going shopping, doing grocery shopping is still women. Like we are still, like, there's still the frontline workers, the essential workers, and they still go to grocery shopping. So there's just more chance of women out in the public and then, getting attacked, right? But also, I think in this particular context, like, sort of Asian, specific Asian racism, racism targeting Asian in particular, I think it's also probably has something to do with this stereotype, like, about Asian women, like, where we're seen as more submissive, like, it's like, so in the view of the races, they probably think that the Asian women are easier target, right? So, and so I think it's like the two together make women more at greater risk of being attacked during the pandemic. But we're also seeing, I guess, the other form of violence within this context, in the sense that, because I don't know if anyone has done a study, although anecdotally we're hearing that there are more domestic violence incidents during this pandemic because people are, kind of just cooped up at home, right? We are also hearing some from our clients as well, and I recall one intake in particular, and it's happened after the woman called us after the attack in the shooting in Nova Scotia, and her husband actually also has guns at home, and he made reference to the Nova Scotia mass shooting, right, as a way of kind of telling her, you better listen to me, right? And of course, we know that even before, again, it's like, it has nothing to do with the pandemic. Women who are, with precarious status, like, are often at higher risk of domestic violence. And so we are seeing those cases still, like, coming to the clinic. I still have, even though all the tribunals, courts are shut down, but we still have immigration cases. It's still going on. We still have women coming to us, non-status, left home because of the violence at home. So I totally agree with everything that Elaine has said. And I think we need to kind of think about, so I don't tell my client, don't call the police, because I do know that, and sometimes when women are being, they're facing violence at home, sometimes the only safe way out is when they call the police, and then, the police, it doesn't always work, but, but sometimes that's how they get out of the abusive situation. So I think we kind of have to think about how to respond to, while acknowledging the issue around racism, but at the same time, how do we work with the issue around safety for women who are facing domestic violence. And also there's this, everyone has mentioned about this inequitable policing, right? So like, they don't go after white guys in Trinity Bellwood. But then we are also seeing a number of hate crimes being reported are not investigated as hate crimes. There are a couple of cases that are very, they're reported in the media. So it's like high-profile cases in Vancouver, in Saskatchewan, where they actually have arrested the guy who pushed this 92-year-old man in Chinese Canadian man in a 7-Eleven store. There's a 15-year-old who was being attacked in Saskatchewan. The police caught the guy and still not charged the guy for hate crime or hate motivated assault. So, I mean, in those situations, I do want the police to arrest somebody, right? So, but at the same time, like, they are not actually applying the law the way it's supposed to, right? So I think it's really highlights, once again, like everybody's saying the same thing, like it's sort of like the racism within the police force. It's not just, and I remember doing this survey a number of years ago. It's not just about being racial profile, but also how police respond when people of color are victims of crime, right? So we are underserved when we're victims of crime, but we are also over-policed at the same time, right? So, and that's true for Chinese Canadian, and because that particular study looked at Chinese Canadian, African Canadian, and white. So, and it's the same kind of thing, right? So both Chinese Canadian, Black were underserved when we're victims of crime, right? So it's those kind of issues that we, because if you think of who are more likely to be victims of crime, then that's the gender angle is also being added to it as well.
Thank you, Avi. And I mean, I think that what's fascinating, and I'm curious, Evelyn, I'm going to maybe lobby this over to you. Maybe it won't be fair, but I feel like to some extent the kind of ongoing, for the past several years, especially heightened awareness of anti-Black racism, right? And it feels like the visibility of racism against Asian communities to some extent is more visible now. I wouldn't say that it was not there pre-pandemic, but it's much more on the surface in the way that anti-Black racism has been on the surface. What potential is there maybe to learn across these spaces? Obviously, there's different kind of histories of how racism unfolds for different communities. I don't want to get into like a comparison, but what maybe potential intersections do you see in the work that you're doing as well?
Yeah, actually, I think that's a great question. Because one of the things that we do in the Confronting Anti-Black Racism unit is to make sure to ground the conversation in terms of a historical analysis, right? So what has happened historically that allows for the conditions that we currently exist in. And you can think about, historically for Chinese Canadians, particularly in Toronto, the kind of, for example, like sanitation that was denied to like institutional sanitation. This is like government not denying sanitation to specific areas. And then that reflects on the bodies of the individuals, right? So now it's like Chinese people are dirty or whatever else it is, when really it was the government who was saying, we're not going to provide sanitation to these specific areas. And so and making sure we highlight those kinds of historical connections is really, really important to contextualize the conversation we have now. Because at the end of the day, these things are not just coming out of nowhere, right? Like it's not just popping up just because there's this pandemic or whatever else it is, that there has been historical conditions that allow for us to continue to operate the way that we do today. And we have to have those conversations. Whenever I do like the anti-Black racism trainings, I tell people, you know, now it's probably a little bit more common, but okay, slavery existed in Canada. Peter Russell, for example, Russell Street was a slave owner, et cetera. And people are shocked, but what it does is it really brings them to a place where they can understand what I'm talking about now in the contemporary moment. And I oftentimes bring in examples from other communities, Chinese community, et cetera, because that kind of institutional racism that marks bodies has existed historically in Canada, and it's completely erased, right? So the other thing I wanted to mention too was even around the data collection and how data collection and even race-based segregated data then gets used again against people, right? Like, so yes, these are the communities, here are the postal codes. Of course, I knew it was these specific people, but then if you're not connecting it to the institution, the historical or the institutional reasons why it's these specific communities or these specific people, how close proximity are people living in specific areas and specific postal codes? How does that have to do with government and and city planning, for example? So it doesn't become about individuals, but it becomes about the conditions that are set up for individuals to contract COVID or to be outside or to have to do X, Y, and Z. Like one of my biggest fears is the report that just came out the other day around the long-term care facilities, but we know who are highly PSWs and who people are going to point to blame for the conditions that are in these long-term care facilities. But these long-term care facilities have been getting funding cuts for how long, and people have been trying to draw attention to that for how long. And so even though now it's the workers and the frontline staff who are going to be blamed, and we know who those are, these are Black and racialized women and non-status, et cetera. These are the people who are going to be blamed and made to feel guilty and made to feel dirty and et cetera, when they were never put in a condition to be successful to begin with, right? And I think we have to have that conversation. I wanted to give some insight in terms of some numbers or some of the things that we're seeing at the city. So there has been an increase in DV and IPV related calls, especially for crisis lines. Partners are identifying that people who have never called before are calling now to report partner abuse, and the calls are generally shorter than they used to be. So before, the calls would be about 30 minutes. Now it's about 10 minutes when, for example, the partner has stepped out to the store or is going to run a quick errand, and so the calls are shortening. And as previously said, in a lot of cases, people are not wanting to call law enforcement because they don't want a legal situation, particularly because of COVID, and not wanting to call police because of COVID and to get, to make a legal situation in a time where everything is just so confusing. And I think people probably are aware of the situation that happened yesterday, where this young Black woman was died, I think in the Hyde Park area, where police were called, right? And now family and witnesses are saying that it was the police that caused her death, whereas police are saying it was a suicide. But the whole point here is that when people are calling police, like, there shouldn't be fear that that's going to be the outcome. And for a lot of communities, when people are calling police, like, people have to weigh out, like, what are the benefits of me calling the police? Is it like, and that shouldn't be a question. And that's mainly for racialized women. That's mainly for Black women, where it's like, the help that I'm going to get from the police, or the situation I'm in now, is actually better than the help that I'm going to get from the police. That shouldn't be somebody's thought. And so as we think about law enforcement and we think about criminalization, like, that's part of it, right? Police are not helping, and people are finding that their situations, there's a possibility that the outcome of the situation is going to be worse than the position that they're already in when they're in an abusive situation. So I can leave it there.
Yeah, I mean, I think you tied that together really well, and also what's at stake, especially when the first responders in terms of emergencies, like the police, are not a safe option all the time. And I believe so there's so many things that you all have raised. I think at this point we wanted to turn it over to, I think Margarita was going to respond or read some of the questions, and then we'll come back to the panel. I mean, we're going to ask you a little bit more of like a visioning question so you can start thinking in mind how we can start to plant that seed for the world we want to live in. But Margarita, I'll turn it over to you to glean some questions that have been coming up from attendants.
Great, yes. And thank you to everybody who's participating right now, submitting their questions. We're going to do our very best to share all of these questions with the speakers. Actually, I think we're going to go with what was just being spoken to. So different sources of violence, speaking to the systemic forms of violence when thinking about non-status refugee and immigrant women who are impacted by gender-based violence. One of the attendees says, how do these incidents of racialized forms of violence impact women's willingness to approach for help? So how can we think about rebuilding their trust in the system and ensure that those who need help are actually able to reach out?
That's great. Thanks, Margarita. Maybe we'll start, Natasha, with you, and then we can go around and see who else wants to jump in.
Here, I'll help. Let's see if I can help with audio here.
Oh, okay.
Awesome.
Can you hear me?
Yes.
Yes, we can hear you.
Yeah, no, that's a very important question, and I think Evelyn really summed that up for us in terms of people making choices around protection from the police, not being forthcoming for particular communities, and I think some of the work I've been doing, I'm not sure if I'm comfortable saying with police, but about policing, has been to institute race-based collection policies. So as of January 1st, Toronto Police Services have to collect the race of every individual that they interact with. And we're particularly looking at use of force or situations where this young woman has been allegedly somehow killed by the police. What we're trying to do is to improve outcomes of Black people in particular, but racialized communities in general, when they interact with the police. There has been a focus, obviously, on male interaction with the police. There's an overrepresentation of deadly outcomes in those interactions with the police, but now we're seeing more women experiencing those outcomes with the police. The other thing that I didn't mention, but I think we have to think about, especially if we're talking about racialized women, is how child welfare also gets pulled into this conversation. So some of the reasons why women often don't go to the authorities is the fear of loss of children, which is a significant reality when we're looking at racialized women in particular, and when they're interacting with law enforcement. Particularly when it comes to domestic violence and gender-based violence. So right now we have a system where the criminal justice system is not supporting us as racialized women to achieve, I think, the healthy living standards that we want, or to help eliminate the violence in our lives. We've heard Elaine talk about how they're also perpetuating and increasing violence levels in our lives as racialized women. So I think a lot of the work that we have to focus on is how do we reform policing, and how do we address the fact that that system is based on the legacy of white supremacy.
Yeah.
And what are the things that we need to do to advocate to make changes within that particular system? Because right now they're only providing support for white population. We are not seeing the benefits of policing in this city anyway. I can't speak for across Canada, but I think the situation would be very similar, no matter where we go in Canada, where we are not benefiting from the supposed institution that is supposed to be protecting society.
Can I add to it?
Please do, yeah.
Okay. Yeah, I totally agree. And actually, we were also involved in that the community consultation that the Toronto Police Services did. And so it's kind of funny because they approached our clinic and then they said that, oh, can you consult with the Chinese and Vietnamese community? And I said, well, do you have any information in Chinese and Vietnamese? And they're like, no. So I said, well, you can pay me to do the translation and do everything, and then I will do it. So in the end, we did get paid. And then through the process, and as you can imagine, a lot of people say why, like Evelyn raised that point too. People are very fearful what the police will do with the information that they collect, right? So, but at the same time, knowing, acknowledging that we need the police to collect information to show that racialized communities are, disproportionately policed, and and all that kind of stuff. So one of the things that we have also been trying to do is that, because sometimes the police are called to domestic violence situation, sometimes by the woman, but sometimes by the man, right? And we see a lot of cases where the police are called, but because the husband or the male spouse, for instance, they speak better English than the female. And instead of charging him, they charge her instead. So we have some situations where that happened. And we have filed a number of police complaints when it's clear to us that she is the victim of domestic violence and not the guy. And one of the cases where we complained was the police did not charge her, but in the report that they released, they talked about how she was using her husband to get status in Canada. And so we filed a complaint about that report. So I think maybe we should think about what we can do collectively to basically collect this kind of story. And I try to convince OIPRD to do a systemic review of how to deal with domestic violence calls. I didn't get anywhere, even with Jerry McNeely when he was there. So I think maybe we should think about what is it that we can do to get the OIPRD to do a systemic review on how the police respond to domestic violence calls, how often the women get charged as opposed to the guy. Sort of do a very thorough kind of investigation into how this issue is being dealt with in particular. And it's just one example of the gendered racial, and I'm sure it's not just because of her gender, but because of her race that our clients are experiencing that. So how the gender and race and immigration status in some cases affect police decision to lay charges against who, right? So I'm very interested in doing that work, and if anyone wants to work with me, please let me know.
Can I jump in? You can hear me, right? Okay.
Yeah.
I wanted to talk about a woman's autonomy, particularly racialized women's autonomy, and what that looks like in domestic violence situations, right? Where what the police want is trumps what the woman's autonomy is, and how historically relationships between racialized communities and police have always been very paternalistic. We know what's best for this community. We know how to protect them. We know what you want is not what's best for you, right? Like what you want is it doesn't make sense to us, right? Like why would you still want to be with this person who is abusing you, for example, without considering why that person might want to be in that situation, right? But it's like so therefore you deserve what's happening to you, and you can be shamed about that. You can be made to feel guilty about that. You can be charged for that, right? Like you can be charged if you don't want to file charges against the person, etc. And so the question around like how do we rebuild trust, I think we need to think about what autonomy looks like, and how we can and how do we what we want in terms of society and what our societal values about what healthy relationships look, or what a relationship is even supposed to look like, how that plays out in these situations. And so how you imagine your relationship is not valid for us. And so we have to come in and fix that for you somehow, whether it is by taking away your children or by forcing you to punish your partner in a particular kind of way or whatever else it is. And so that autonomy is not there. And if I don't feel like I have an autonomy when I'm calling the police, I'm not going to call the police. If I feel like I'm going to be shamed when the police come to my door, and their will is going to be forced on me, I'm not going to do that. I'm not going to do it. And so in terms of rebuilding that trust, then I think we have to have the conversations about and reframe women's power in these kinds of situations. And I would also say something about almost, having a system where, so for example, with this situation now the SIU is involved, right? But this is after the fact. But what happens if when you call police show up with somebody already, right? Like they already show up with a social worker. They already show up with somebody who can support them through the process rather than after they show up, right? Because this situation that happened, it was a domestic violence, and now it's after the fact, this SIU, and you have these independent bodies that are coming to figure out what happened, but that's not of any use. But if I shouldn't say it's not of any use, but it's problematic, right? And so, but what happens if in terms of rethinking this relationship, we think about how we can have advocates at the time of the call, at the time of police showing up. We have people that can give voice, can allow women to have their voices, and can ensure that there's a transparent process and et cetera. And I think that might be a way for us to think about like rethinking the system and how it functions.
So, and I want to add quickly, so I really think that everyone should have rights to access the support, particularly from police or legal system when they want to. And I think it's also very important creatively how to create alternative system, because when we see so many women come together, there is so many creative things people think of how to keep themselves safe, but it's often they may not have resources, power to do it. So, and then how as the advocate or service provider can work together with the woman to develop different safety plan individually or systematic support that the people can, other than police, they can other place they can go. So, and I think this is very important that we keep thinking that as I really agree with the agency of the woman, so that, but the people cannot exercise agency when there is no resources, that the only way they call 911. But other than 911, whether there is other resources, we see how so many violence against women organizations, they are like so busy and even difficult to have people take the phone because they have really great demand with very limited resources, right? So, and I think, and how to support the community themselves that to develop some effective system they can protect themselves. And if you talk about the collective action, and I think, for example, access without fear policy, we know that it's not perfectly enforced, but that is very, very important, like policy to empower the worker and the advocate, that we really find actually some worker, they are because of this policy, they can really make themselves less problematic when they call the law enforcement. And so I think this is something we really need to continue to advocate to make sure this policy is enforced for those places they don't have this policy, access without fear policy and decriminalization of sex work. So that's a very, very important policy change can help the workers or the people, the women can get the power that then they can have less fear when they get support.
Mm-hmm.
Such rich responses. Margarita, maybe you can see if there's another couple of questions from the attendees.
Absolutely. Thank you. And yes, thank you to all the attendees who continue to submit questions. I think we do have a few questions that can kind of be grouped together here, speaking to these histories of violence and also thinking about the way that mainstream approaches can be at times uncritical, ahistorical, and not work for racialized communities when we're thinking about especially non-status refugee immigrant women. One of the questions here is wondering how these forms of racism intersect with settler colonialism and the ongoing genocide of Indigenous people and missing and murdered Indigenous women. And the question there as well is, how do we build solidarity, and how can that help us better understand gender-based violence facing racialized communities, this type of solidarity between movements? You want to speak to that?
I don't know if someone wanted to go first. Evelyn, would you like to jump in?
Sure. Yes. Yes to that question. Just yes to that question, right? I think that there, in the context of thinking about the genocide against indigenous people, and settler colonialism, you know, missing and murdered Aboriginal women, the fact that that's still, like, we still are not taking that seriously, right? Even though this report came out, and the kind of gendered violence that has been perpetrated against Indigenous communities for so long, that continues to exist, but because it's out of sight, out of mind, it continues to not be addressed and taken seriously, or resources being directed towards that. Every time I talk about this issue, I always ask, like, if the same amount of women were missing and murdered and they were white women, what would that response look like? Let 5 like white women go missing somehow, or murdered, and let's see what the response is going to be. And part of that is, like, who's within our vision? Who can we see? Who do we see, and who don't we see? And there's a way in which settler colonialism has completely erased Indigenous people, in a way where the average person, the average Canadian, doesn't see what's happening, and even when you try to raise these kinds of issues and have these kinds of conversation, there's still so many gaps in terms of what we can actually talk about, or how we can bring people to have these conversations together. And so I think I don't know if we can actually even look to the case around the missing and murdered Indigenous women, because I don't think that's even being handled in a way where it's not being handled by government in a way where there's an actual response to me. I feel like it's still not being responded to in a way that is accurate, in a way that is actually going to make a change or be impactful. I think the work is being done on the ground. And again, when work is being done on the ground, it sometimes seems to not have any legitimacy because it doesn't get taken up in media, or it doesn't get taken up by scholars in a way where it legitimizes that grassroots work. Right. We saw recently with the blockade that was really happening, and you saw specifically Indigenous women protecting the land and holding their ground and having those conversations. But at this step, that's very grassroots. That's work that is not it gets taken up by media in a particular kind of way, and the focus gets shifted on a kind of violence that they're doing to other people, right? And then the narrative changes. And so, like, in terms of learning from that, there's a way that we have to then be able to not just legitimize, but to look at for solutions from grassroots, look at solutions from Indigenous people on the ground. But I've yet to see that be taken up in a way where others can really learn from it. I can't really speak to the question around like solidarity either, because I think that we get pitted against each other so much in terms of like the racial Olympics and who's suffering more and who needs more resources and who needs more attention, that we can't even really begin to think about solidarity until we can really confront that pitting against each other in terms of resources.
Can I?
Yeah, please do, Avi. Yeah, I was just thinking, just in terms of what Evelyn was saying, like forms of solidarity, and how I think the Wet'suwet'en collective actions that were happening just before this pandemic, and it was occupying all of my political attention, and I think in a very important way as an immigrant settler in this space, and figuring out what I can do. And also some of the analysis that was coming out that really was making more visible how the construction of the pipeline and that economic stripping was so directly connected to gender-based violence. So I feel like there's a lot of lessons we can take and ways we can maybe find room for solidarity there as well. Certainly in terms of the previous discussions about the economic injustice and its racial and gendered pieces around who are the care workers with the pandemic. But Avi, I don't know if you had something you wanted to add. You were just about to say something.
I just want to add 2 very small examples to say how far, it's like we have a long way to go. So, for instance, as it was mentioned before, I'm part of the Color Poverty Color Change. So we have like a series of fact sheets, and the fact sheets have a sort of like on the front page it says, we acknowledge the indigenous people's relationship, nation to nation relationship with Canada, like, sort of talking about the colonization of indigenous people, all that kind of stuff. I had to send it to an translator to translate in different languages. I only speak Chinese. I don't know how the other translator translated it, but I saw the Chinese translation. I have to send it back to the interpreter, because instead of translating nation to nation, I can't remember what is the exact word they do, because they just do not understand this concept. And then I had a huge argument with the interpreter, because he said, well, how can it be a nation to nation? Canada is a country. These indigenous people are, it's like an ethnic group. Like, basically it's like these are ethnic groups within Canada. So I had this huge argument with them. And in the end, I don't think they understand what I was trying to say. But I think that's the reality of a lot of the people. They don't even understand that basic concept. So when you talk about settler, we're a settler, I don't think people understand that. I don't know how we can make that more that kind of education more accessible. So maybe it's something that OCASI can think about. I know that I've talked to Amy from time to time about what do we do to educate. Like, there's a little bit of this kind of information in the citizenship, the materials for people who want to become citizens of Canada, but it's very problematic. Like, the materials that were provided are very problematic. So I think really it's like, I don't know when we can even talk about solidarity when people don't even understand the very basic kind of notion, right? So, but at the same time, like, with the COVID-19, so for instance, like, and I hope, and, we'll have a chance to talk about it more. It's like I'm hoping that this is the opportunity for people to understand racism affects all of us. It's like there are indigenous people who are being quote unquote mistaken for Asian and being attacked. And so the BC chief has come out in solidarity with the Asian Canadian community. But we should be doing that. You know what I mean? It's like the opposite should also be happening. So hopefully this will give us a chance to start talking about that kind of solidarity work.
Yeah, can I add?
Please do. Yeah.
Absolutely.
This is a crucial conversation, and I think for those of us, I'll speak for myself, the work that I do is about supporting racialized and Black women in particular, but I have to always acknowledge that it can never be at the expense of our Indigenous brothers and sisters in their communities. I think it's also important to understand that we are in a constant state of reconciliation. So your work always has to be in the producing of solidarity with the aim of reconciliation, because Indigenous people have done their work. If we look at the Truth and Reconciliation process, they've told the truth. Our work is the reconciliation piece. And so, I've always brought that into my work in terms of my education and especially working in healthcare. And I work with disparities, racial disparities in health outcomes. There is no health outcome, and Black people will be at the bottom of every poor health outcome in this country, but there's no health outcome that we are not exceeded by Indigenous people. And if we look at SARS, for example, the SARS pandemic, racialized communities were the first hit and the hardest hit with the initial SARS outbreak. And I think if we collected the data for COVID, we'd see the same thing. So I think it's really important for us to understand the legacy of colonization and to understand that when that groundwork was set in Canada before many of us arrived here, it was already primed for us to have the poor experiences that we're having because Indigenous people experienced it first. Exactly. So I think our work always has to have at the forefront, how are Indigenous people going to be pushed ahead of us as we try to move our communities ahead as well. really quickly an example, if we look at the domestic violence situation, as groups and organizations that were lobbying to increase funding for the domestic violence shelters, what became very apparent in that lobby were that Indigenous shelters were even more grossly underfunded than all of the other shelters. And so in our lobby, the commitment that we forced the government to enact is that Indigenous shelters would be funded at the same level as all other shelters. And then we would all collectively move forward to push for increases for all shelters across the province. So we have to keep thinking about our work in that way.
Thank you, Natisha. I don't know, Margarita, maybe we have time for one more quick question and quick round of responses.
Great. Yes. You know, another question that's coming out as well is thinking about, in relation to this, if people have thoughts around kind of that debate between police reforming and also the want to abolish it. So speaking a little bit more to reforming police measures and the way that gender-based violence is being responded to.
Great. So maybe, Aline, if you want to start there, like the potential to reform versus just abolish the criminal justice system. And I think your microphone is not yet on.
Okay, yes. Yeah, so I think it's very clear that we have systematically think that we need the powerful state, powerful police to protect, to make people safe. But I think what we learn from the history is not always true. And I think for me, the goal is really hope that we can build a society, community to find really the alternative way to see what is the other system. So because I think sometimes no matter violence or like something is actually reflect on many other issues, right? For example, domestic violence. So there is a lot of issue behind that. So instead of like just find a perpetrator to blame them, so I think there is a lot of work we can creatively do to fundamentally change the system of the society, not only the law enforcement. So, and I think no matter how we advocate the system change of policing or like police or law enforcement, I think we always need to bring in mind those kind of system is always the people have power, continues to maintain the power, right? So, and I think that is something we just like, I think sometimes we are too ideal that they're the hero come to save everyone. So that is not how they develop from. So, and who are the people they are protecting? Who are the property they are protecting? So I think there is something we may need to have more chance to reflect more and develop like different alternatives. So, and I forgot to mention, Butterfly have produced a legal training on migrant sex worker and violence against them with also a legal clinic. So, and there is some information that how to support the people individually think about what is the alternative. But I think in for us, like advocate or like bigger society, we need to think what is the alternative of our social system. Yeah.
Mm-hmm.
That's great. Yeah. What are some alternatives? I'd love to hear from. Please.
I certainly believe that there are, you know, if there are alternatives to police, then we should always go for the alternative first. However, I actually think that the people who think that, maybe it's my way of thinking, the people who think that we can abolish police are the idealistic ones. I don't have enough faith in human race to say that we can get rid of violence one day, you know what I mean? Particularly male violence. I don't see it happening within my lifetime for sure. But I do agree that there's so much that needs to be reformed, and there's so much that need to be decriminalized, right? So, and I think that so you know, we should kind of do things in a parallel way, instead of just saying let's abolish now and hope that nobody is going to kill nobody, right? But let's kind of move forward as we sort of reform the society as a whole as well, while we at the same time find alternatives to policing.
Can I also jump in? I can be quick, but I think about rather than abolishing or like police reform, for example, the need for the police and why our society has such a great need and dependence on police. And so how do we address the issue, the societal issues that cause us to have such a high reliance on police, for example? So one of those things is obviously the lack of other alternatives to police, but also if we're thinking about domestic violence, like are we accurately addressing toxic masculinity and what causes people to end up in these situations where they have to call the police to begin with? Why are men so violent, and what does that mean in terms of our whole society? How can we support youth to be in better conditions and to get better outcomes so they're not finding themselves, homeless or on the street or whatever? How are we supporting queer youth, for example, so that their outcomes are better? How are we doing all of these different things that will mitigate and minimize people's interactions with the police, so the police can exist, but our reliance on the police is not as it is right now. If we think about our budget, like a lot of money goes towards policing and continues to increase without an additional supports going towards social issues, the social determinants where, if you support people to have better outcomes, then their interactions with police might be less. Are we addressing anti-Black racism, for example? Are we addressing racism so that we're just minimizing how people are treated and therefore having to call police or interact with police? And so till we get to a point where, as Ivy mentioned, like the ideal is to like not have police. At the same time, can we actually address accurately, and I believe we can, the reasons why we rely on police so much within our society?
Yeah, I mean, I think what is fascinating about a conversation of abolition is it takes us away outside of our existing reality, trying to imagine something that doesn't yet exist, but maybe a direction we can move towards. And I feel like the pandemic is outside of anything I could have ever imagined. Many of us never in our lifetimes had this type of experience, and across the globe, really. And so I'm curious, maybe, and this is a little bit transitioning as well to our final comments, since I'm looking at the clock, we have about 15 more minutes, is like, what can we think about moving forward? Especially, I'm personally worried about the loosening of some of the health measures, not so much because I want to stay at home and I want other people to be able to go back to work, but because they may be good for economic reasons, but not good for health reasons. But I'm curious, from each of your work, what do you hope for as the country returns to some degree of normal? And what kinds of maybe sustaining structural changes that have happened you'd like to see stay in place? Like for me, for example, in Ontario, waiving the 3-month requirement for people who relocated to Ontario to be eligible for the Ontario Health Insurance Plan. I don't see a reason for that to go back. Allowing people to have access to emergency health care irrespective of their insurance, there's no reason for that to go away. These are my personal wish lists. What do you see as things that you'd like to see stay in place, and maybe other things that you're hoping we can work towards to ensure there isn't continued? I mean, you all raised so many issues that are happening, but that we can try to rally around as the country tries to return to some semblance of normal. I'm not sure the order we want to go in, but Eileen, if you'd like to get us started, and then we can I'm looking at my screen, we can go across.
Yeah, it's so difficult to answer. So it's because there is
dream big.
Yes, I want to say I'm a dreamer. So, and then I think what we have today, what we happen today, is not something we never can dream of and imagine. Of course, sometimes we need to realistic. But I think having the chance to dream together, and I think how to bring the community together, to dream together, to think together, to fight together, I think is important. But it's hard because the society keep dividing us, right? Like there's racism between different group and indigenous migrants. So it's like there is how the power can be maintained by keep divide the people. But I think it's important that how we can do more, like grassroots work, not only the people can have chance to connect to that like radical idea or like the progressive idea, because we see how mainstream media is being dominant to maintain certain like system, right? So, and I think that how we need to use them, our different creative way to build the power of the community and dream together. So, and yeah, we hope one day it will happen. Even we cannot see that, even in our life, when our life it may not long enough to see it, but I think it's still important to dream together.
Thanks, Celine. And I think you really convey the emotion, right? Like that is involved in being able to have that kind of hope. Evelyn, if we could turn to you next.
Sure. One of the things I've been thinking about is how we can, first of all, not return to normal. Normal was not good for way too many people, and we should not return there. But what we've seen is that there has been a level of responsiveness, and also government making themselves more available to hear the voices of citizens in a way that I've not seen done before. So there was a town hall that the mayor had with the Black community. Rob Ford had a similar. So there's been a way where it's like we can actually hear voices of people, and I'd like to see that continue, but more so on a more concrete level, more practical level, thinking about what the careers and the jobs and the work that we value, that we have historically valued. And if we can reimagine, like, what is essential, what is important, what do we need as a society for everybody to be okay, for everybody to be healthy, and how can we properly support those specific areas? So, we've been saying a lot of thank yous to the grocery store workers or like these frontline workers and that kind of thing. And I keep saying like these thank yous are not enough for people who have been living very precariously, and who, even during the pandemic have been at a higher risk, and the work that they're doing, the way that they're working now is not sustainable at all. But at the same time, how do we reimagine what we value in our society in terms of work and in terms of these kinds of conversations? I'd like to see more resources dedicated toward just work and workers and working class, and that kind of support. And I think lastly, I would say that the kind of cultural responsiveness has also been interesting for me. So we've been able to say specifically, the food that is provided at food banks is not culturally specific enough, and so and then being able to respond to that. So that tells me that this has always been possible. We needed to be able to think about it in a different way, and we were forced to think about it now. But it creates so much opportunity for us to now recreate how we've been living this whole time. And I think there has been a lot of fear expressed by different people in terms of what happens when the pandemic is over and that basic income I was receiving, I'm not going to receive it anymore. And I don't think people want the pandemic to continue, but some of the benefits that they've been experiencing because of the pandemic are very real for a lot of communities. And so how do we make sure those things become permanent? And that this kind of reality around getting rid of red tape that we were convinced that this red tape could never go away, right? Like we could never get rid of any of these things. We could never fund grassroots organizations. But we can do all of these things. And now we know what's possible. And so to make sure those things become permanent is what I would like to see.
Thanks, Evelyn. And then maybe to you, Avi, how you think we can leverage this political will into the future?
So I was talking to Debbie Douglas from OCASI the other day, and she was saying that we don't use the word recovery, we use the word reconstruct. So, we're now trying to reconstruct the whole society. Again, I guess I'm more realistic than an idealist. And I agree with everything that's been said, like all the benefits are here and stay, all the bad things, go away. But because as Elaine mentioned, like, even the benefits are not accurately accessible even now, right? So even under the pandemic, we still see a lot of clients at our clinic that are not able to access the benefits. And that's same with at the provincial level as well. So I think really is, and how do we, but I think it's the possibility that that is opening up the opportunity for us to do something. The possibility that red tape can be removed, possibility that we can actually provide these benefits, the possibility that the government can respond to community needs in such a way, possibility that more funding can be provided to healthcare workers and all that, and possibility that, just with a snap of a finger, some of these workers get a wage increase when 2 years ago, Upward would not even increase the minimum wage to $15, right? So how do we maximize the possibility by appealing to, I think, the good side of the of the Canadian public, right? So because we know there is a lot of the bad side going on, which is why we see the rise of racism. And so maybe, so one thing that Color Poverty is trying to do, and I think different organizations are trying to do the same thing as well, is to use the opportunity to reimagine what kind of society we want to live in, what are the recommendations that we can make to Canada, to the very levels of government, to change our society for the better. So maybe more conversations like this, more opportunities for groups to exchange idea, so that we can kind of present in a very united, uniform way. Here is the list of 200 things that we need, top to bottom, and to make it a more equitable and just society. So that's what I hope will happen.
Thank you, Avi. And Natisha, if you'd like to add or close us off here.
It's such a hard question. I was thinking as people were talking, I've been in healthcare for 32 years. And so I've been through HIV, I've been through SARS, I was working in Sierra Leone during Ebola. We've had a long lead up, if you've worked in healthcare, to this point. We've known it was coming. We've been preparing for it from a healthcare perspective, but not from a societal perspective. And so to see us in the situation that we're in, where the disparities, particularly with racialized communities, are so evident, when we've had enough time to address them and know what was going to happen when COVID or something similar to COVID hit, and not be prepared was very disheartening. So, for me, future is to understand that we know what the outcome is going to be. So what are the things that we are going to put in place to prevent that from happening again? Some of the positive things that I saw, there are countries who regularized people who were undocumented within their countries. So why can't we do that in Canada? We saw internationally trained physicians get 30-day licenses to help with COVID. Why can't they all get their license? Or those that did, why can't those licenses be maintained? And why do we have a system that keeps putting racialized and immigrant professionals in lower status categories where they can't practice their profession when they get here? I'm also thinking about the stigma and trauma recovery. So when I talk about stigma, coming from a community where we often get stigmatized as vectors of disease, the carriers of disease, and now that is being placed on Asian communities. So we're not going to be bystanders and watch that stigma play out and replicate here in Canada. So what are the things that we're going to put in place to counteract that narrative that's already being developed and then turning into violent racism that we're seeing? And then how are we going to provide supports, emotional supports, mental health supports for the level of death and trauma that we've all experienced over the last 4 months? Those are the programs that I need to see being put in place. And if racialized communities have carried the burden of COVID in terms of overrepresentation and death, what are the extra supports that we are going to be engaged in? And I'm going to leave the policing issue out of my closing remarks, because I want to be idealistic, but I think I'm with Avi on that one. I think the level of reform that's required is very evident to us right now, and I think there are activists who are far more apt at addressing that than I am. But yeah, so many things to think about. I think the idea that we're returning back to normal is just something we have to let go of. We have to think about how we're going to create a better system for racialized communities to function in.
Well, thank you to everyone. And I keep reflecting on how, and as an educator, how we learn so much when we are challenged, when we're uncomfortable. And I think that is an opportunity. Each of you, I felt uncomfortable listening and really internalizing the complex systemic challenges that people are facing that are leading to different kinds of discrimination, reproducing ongoing and historic forms of violence, but also this potential to leverage this moment, and maybe the pain of being hyper aware can be something that we can leverage collectively, because I think a lot of different parts of Canadian society, I'm thinking about the 100+ people who are on this call, like we want to understand better and do better. And I think that is something that you all have really spoken to, even if we're feeling exhausted and need to all go rest after 2 hours on the screen. I am very grateful for the collective learning and also the momentum that I hear each of you speaking about. So I'm going to turn it back to Margarita, who's going to close us out.
All right, thank you so much. Thank you to all of the speakers for your time, for such an informative discussion. We had some really great feedback from attendees, and we will be following up. For those of you who may have submitted a question, we will try our best to follow up with each of you, and also there will be an opportunity to see the recording from this webinar. So yes, to wrap up right now in particular, so thank you very much for sharing and providing us also with a critical lens, and also disrupting some of those narratives. In particular, what really stood out as well was the piece around different groups that are framed as inviting violence, and also the different kinds of frameworks that become available that might be focused on culture, for example. So you really spoke right now to a necessary way to articulate some of these systemic challenges and the different sources of violence to kind of quote Aline there when she mentioned the different sources of violence as well, right? That asks us to challenge some of the mainstream approaches that have been mobilized and organizing the coordinated efforts that don't always work when we're thinking about gender-based violence against non-status refugee immigrant women. We invite everybody who's on this call to join our community of practice. It's a space where we are encouraging people to continue to engage in conversation. We're encouraging people to also stay connected. We are sharing a summary of the different webinar series that we are involved with right now. And in particular, we want to invite people to know that we are going to be organizing more of this type of conversation in the coming months. It's a space for us to leverage these conversations, in particular, to give language, to name some of the forms of violence that we're referring to, and to really have a community of practice among the refugee and immigrant serving sector, and also the violence against women serving sector, that we see different representation, different groups are participating in these calls. So the full potential of these virtual roundtables is really realized when it connects different experiences, different angles that are there. And so we're very grateful today for all the speakers that participated. And we encourage you to stay connected with us. And we hope that you will join the next conversation, and that we will be able to continue to connect with you. So thank you very much for your time. And as Rupaleen said, everybody needs a drink of water and some rest, because it was 2 hours and we've done well. So thank you very much.
Bye. Thank you so much.
Bye.
Take care.
Thanks a lot.
Thank you.
Bye.
Thank you.
Take care.
Take care.